Welcome to the deep dive. This is where we tackle complex topics using your source material.
That's right. We take the documents you provide and, well, we pull out the key insights, the surprising bits.
And basically help you get up to speed, fast. We're really just focusing on what this specific document says.
Exactly. And today, our source is excerpts from ketamine-2020.pdf. Simple goal. Understand everything this document tells us about ketamine.
Nothing else.
Nothing else. Strictly what's in these pages.
Right. So think of this as our mission, yours and ours, to explore ketamine, but only through the lens of this document. What's it say about, its effects, uses, legal stuff?
And it kicks off with a pretty interesting contrast, doesn't it?
Yeah, it really does. It flags it as both a medical anesthetic and something abused for hallucinations, that kind of duality.
That's the core tension we'll be looking at based just on the text.
Okay, so let's jump in, the core definition. What does the document say ketamine is?
It calls it a dissociative anesthetic, and it notes, importantly, that it also has some hallucinogenic effects.
Dissociative anesthetic. Okay, that term comes up right away. What does the source say that actually, feels like for a patient?
Well, according to this source, it makes patients feel detached,
Hmm.
Separate from their pain, but also separate from their environment.
Detached. Okay, that separation idea seems key. And medically, what state is it used to induce? What does the document list?
It lists sedation, immobility, relief from pain, and amnesia. That's a big one the document points out.
Amnesia. Right, so people often won't remember things.
Exactly. That's the medical picture it paints.
But then, bam, the document pivots straight to the abuse potential.
It does, yeah. It says it's abused specifically for those dissociative feelings and the hallucinations we just mentioned.
And it makes another serious point, too.
Yes, it explicitly notes its use in facilitating sexual assault, which is obviously very serious.
So right from the start, we see these completely different documented uses. Where does the source say ketamine actually comes from?
It tells us it's commercially produced in the U.S. and other countries.
Okay, standard production. But for the illegal market here...
For illegal distribution in the U.S., the document says it's mostly diverted, basically stolen from legitimate places.
And it names a specific type of place.
Yeah, it specifically calls out veterinary clinics.
Yeah.
And it also mentions smuggling from Mexico as another source.
Veterinary clinics.
Right.
Okay, that's quite specific. And once it's here illegally, how does the document say it gets around? Is it like open street dealing?
The document says street sales are rare. It's usually distributed more privately among friends, acquaintances.
And in specific settings?
Yes, it mentions raves, nightclubs, private parties as the most common places.
Interesting. So sort of closed circles based on this document. Okay, so what does it actually look like? And how are people using it according to the source?
It describes two main forms. There's a clear liquid,
Right.
and then there's a powder, white or maybe off-white.
And the powder, how does this document say they make that?
It says it's made by evaporating the liquid, using things like hot plates, warming trays, even microwave ovens are mentioned.
To get crystal?
Yeah, to get crystals, which they then grind up into powder.
Okay. And how's that powder packaged, typically? What does the source list?
Usually in small amounts, like 100 to 200 milligrams.
Yeah.
The document mentions small glass vials, little plastic bags, capsules.
Like drug capsules?
Yeah, or just folded up in paper, glassine, or even aluminum foil.
Okay. And the ways it's used, how does the document break that down?
The powder is usually snorted. The source uses the term bumps.
Pumps. Okay.
Or it can be smoked, mixed with marijuana or tobacco in cigarettes.
And the liquid form?
That's either injected or sometimes just mixed into drinks.
Mixed into drinks. Okay, that ties back to the potential for misuse mentioned earlier.
It does. And the source also adds it's often found mixed with other drugs. It lists MDMA, amphetamine, methamphetamine, or cocaine specifically.
Wow, okay. It also sounds like it goes by a lot of different names. The document has quite a list.
Oh yeah, a whole bunch. Let's see. Cat Tranquilizer, Cat Valium, Jet K, Kit Kat, Purple, Special K.
Special K is probably the most famous one.
Special Coke, Super Acid, Super K, and Vitamin K. That's the full list from the source.
Special K. Yeah, everyone's heard that. And the document actually talks about the experience associated with that name, right? Compares it to other stuff.
It does. It says a Special K trip is, well, touted as better than LSD or PCP because the hallucinatory effects are shorter.
How short does it say?
About 30 to 60 minutes, according to the source, whereas LSD or PCP can last several hours.
And the source goes into some really descriptive slang for the different kinds of experiences people report.
Yeah, some vivid terms in there. It lists K-land, which it says refers to a mellow, colorful experience.
Okay, mellow.
Then there's the K-hole. That's described as an out-of-body, almost near-death kind of experience.
Oh, big difference.
Definitely. Then baby food, where users apparently sink into this blissful sort of infantile state.
Baby food. Interesting term.
And maybe the most intense one mentioned is God, where users are convinced they've actually met their maker.
Wow. Okay, so the range described just in this document from mellow to near death to meeting God, that's pretty wide-ranging.
Quite a spectrum documented there.
How fast does the source say these effects kick in?
Rapidly. Often within a few minutes, it says. A bit slower if taken orally.
And are there any, like, long-term or lingering mental effects mentioned?
Yes, the document brings up hallucinogen persisting perception disorder, HPPD.
HPPD, right.
This has been seen weeks after use, and it might involve re-experiencing some of the negative side effects from the initial trip.
And other potential mental or cognitive issues, does it list anything else?
It does. The source includes agitation, depression, cognitive difficulties, unconsciousness, and also amnesia, which we mentioned in the medical context too.
Okay, let's shift to the physical side. What does the document describe happening in the body?
Well, initially, right after taking it within a couple of minutes, the source says there's an increase in heart rate and blood pressure.
Okay, speeds things up first.
Yeah, but then it gradually decreases over the next, say, 10 to 20 minutes.
And the document also describes this state where users can become, like, unresponsive, right? What does it say happens physically then?
Right, unresponsive to stimuli. In that state, the source says users experience involuntary rapid eye movements,
Oh, wow.
dilated pupils, salivation, tear secretions, and their muscles can become stiff.
Any other general physical effects listed?
It also mentions nausea. That's another one.
Okay. And moving toward the more dangerous end, overdose. What does the source say about the effects of an overdose?
The document is clear. An overdose can cause unconsciousness and critically dangerously slowed breathing.
Right, which can obviously be fatal. The document also draws some parallels with other drugs based on effects.
It does. It compares the hallucinations to other hallucinogens like LSD, PCP, mescaline, says they cause similar effects in that sense.
Makes sense.
And then it also draws a parallel on the misuse side, particularly for sexual assault. It notes that drugs like GHB, Rohypnol, and other depressants are misused for their amnesiac or sedative properties.
Similar to one of the documented concerns about ketamine.
Exactly. So it shares features with both hallucinogens and these sedative amnesiac drugs, according to this source.
Okay, so let's talk legal status. In the U.S., what's the story there based on the document?
Well, it states it's been marketed as an injectable anesthetic since way back in the 1970s.
Been around a while medically.
Yeah. Then in 1999, it was officially classified under the Controlled Substances Act. It's a Schedule III non-narcotic substance.
Schedule 3. And what are its current accepted medical uses, according to the document?
The document lists short-term sedation and anesthesia, but it also highlights a pretty major recent development.
Which is?
FDA approval in 2019 for a specific form, the S plus enantiomer, called esketamine. It's a nasal spray, brand name Spravato.
Spravato. Okay, and what's that approved for?
For treatment-resistant depression. But the document adds a key detail. It's only available at a certified doctor's office or clinic. You can't just get a prescription for it.
Right, tightly controlled. And finally, what does this document say about dependence, addiction potential?
It states clearly that ketamine has potential for abuse, and that abuse, according to the source, might lead to moderate or low physical dependence, but potentially high psychological dependence.
High psychological dependence. Okay, so we've really walked through what this specific document, ketamine-2020.pdf, lays out. Why is knowing all this, just from this source, useful for you, the listener?
Well, I think because it gives you a really focused snapshot. It's this document's view of ketamine. You see the risks it identifies, the different contexts it presents, medicine versus illicit use, even assault.
Yeah, it's all laid out there.
And you get the specific details on forms, distribution, legal status, as defined by this one source. It helps you understand how a single piece of information, a single document, can frame a complex substance.
It's like a direct line into the specific data set, isn't it? We've hit the definition, where it comes from, what it looks like, how it's used, the street names.
The really intense effects on the mind and body, overdose risks, how it compares to other drugs in the document's view.
And its whole legal journey, including that recent Spravato approval, all just from this PDF.
And looking back at just what this document contains, That contrast is really stark, isn't it?
Yeah.
You've got this established medical tool for sedation, for amnesia, used legally for decades.
Right.
And yet the same document details abuse for hallucinations, dissociation, with slang describing things like a K-hole or meeting God. It's quite the juxtaposition.
It really is. Which brings us to maybe a final thought, sticking purely to what this document suggests. Given those stated medical uses, sedation, amnesia, and then these incredibly profound psychological experiences described in the slang terms, K-hole, God, what does this document alone kind of make you wonder about the line between an altered state used for, say, medical reasons versus one someone seeks out recreationally? Does the document itself blur that line a bit?
That's a great question, just based on the text.
Yeah.
It certainly makes you reflect on the nature of these profound subjective experiences it documents, regardless of why someone is experiencing them, medical procedure or recreational use. The experiences themselves, as described here, are powerful.
Definitely something to chew on as you think about everything we've pulled from this single source today. Thanks for joining us on the deep dive.